To conduct a document review utilizing the Contract Manufacturers Program under the SQF Module 2.3.3, first check if the document title matches the uploaded file name on the dashboard. In this instance, we do have the same titles as the Contract Manufacturers Program. Next, both must have the same document code. For this example, we do have 2.3.3P0. And since this is a template, we indicate the PCQI as the account initials. However, we can customize the code based on the company's initials. For the page number, we use the page X of Y format to ensure that it reflects the current page position and the total page number of the document. Then insert the company logo here, along with the company name, the company address, and enter the designated department. For the originated by section, it can be the food safety, quality assurance, or the quality control personnel of the company. The originator ensures the implementation of the quality management and document control system. First, enter the name of the originator, affix the signature, input the position title, and the date originated. For the reviewed by section, it can be the personnel assigned in the Quality Management Department who reviews the drafted document or its revision for accuracy and implementation. First, enter the name of the reviewer, affix the signature, input the position title, and the date reviewed. For the approved by section, it must be the person in the C-level management who has approval authority. First, enter the name of the approver, affix the signature, input the position title, and the date approved. The revision date is the same as the date originated or drafted by the author. For the effective date, it is the date the document was signed and approved. The publication date is when the document is published for distribution and initiated personnel training. The implementation date is when the document is distributed and personnel training is completed. For the supersedes, put original for the initial issuance of the document. For any revisions, reflect the initial revision date before the current revision. Please be reminded that this section must be properly filled out to be compliant. Now we will focus on the components of the program. First is purpose. The purpose is the implementation of any certification standard or compliance with a regulatory requirement. For this program, it is for implementation with the SQF Module 2 Edition 9 for food manufacturing under Clause 2.3.3. The first purpose is to comply with the prerequisite requirements of 21 CFR Section 117.110 defect action levels. The manufacturer, processor, packer, and holder of food must at all times utilize quality control operations that reduce natural or unavoidable defects to the lowest level currently feasible. Second, to implement SQF 2.3.3.1, the methods and responsibility for ensuring all agreements with contract manufacturers relating to food safety, customer product requirements, their realization, and delivery shall be documented and implemented. Third, to implement SQF 2.3.3.2, the site shall establish a method to determine the food safety risk level of the contract manufactured product and shall document the risk. The site shall ensure that 1. Products and processes of co-manufacturers that are considered high risk have undergone an audit by the site or third-party agency to confirm compliance with the SQF Food Safety Code food manufacturing and regulatory and customer requirements. 2. Products and processes of co-manufacturers that are considered low risk meet the requirements of the SQF Food Safety Code food manufacturing or other GFSI benchmark certification programs and regulatory and customer requirements. And 3. Changes to contractual agreements are approved by both parties and communicated to relevant personnel. Fourth, to implement SQF 2.3.3.3, Contractual agreements with third-party storage and distribution businesses shall include requirements relating to customer product requirements and compliance with Clause 2.3.3.2 of the SQF Food Safety Code Food Manufacturing. Contractual agreements shall be approved by both parties and communicated to relevant personnel. The site shall verify compliance with the SQF code and ensure that customer and regulatory requirements are being met at all times. And fifth, to implement SQF 2.3.3.4, records of audits, contracts, and changes to contractual agreements and their approvals shall be maintained. Next, the purpose is scope. The scope of the program is based on the purpose and serves as a guide in defining and describing the layout of the procedure. It includes the verification schedule, sampling plan, internal audit procedure, and customer specification. Third is policy. The policies are the rules set by the company as their implementation guide. Under policy, establishment utilizes contract manufacturers to produce, process, pack, and/or store part of all or one or more products included in the establishment product scope, either intermittently to fulfill or supplement the site's production. Second, in part or whole, the contracted facility used by the establishment, in part or whole, an SQF certified product fulfills the same requirements as the SQF system at the establishment or equivalent thereof. Third, contracted manufacturers undergo an audit of the requirements of the SQF code. The audit may be conducted by the site or by an independent third-party agency and conducted annually. The audit report is collected and retained by the quality department. And fourth, the contracted manufacturer's site has a documented procedure detailing how they will ensure that the contracted product in their care meets the manufacturer's customer specification and the requirements of the SQF code. The fourth component of the program is procedures. The procedure is the step-by-step process and the actual implementation of the policy. First, under procedure, quality management system controls required for contract manufacturers include management commitment, prerequisite programs, document control and records, adhering to specifications, the food quality plans, food safety plans and HACCP, and the quality controls. Second, under procedures, the contracted manufacturer's SQF certification is preferred. However, in the event the contracted manufacturer does not have the SQF certification, the establishment audit of the contracted manufacturer based on the SQF Food Safety Code and control of the conditions in the contracted facility via 1. Sampling. Samples are collected and routinely sent to customers for approval of any changes to specifications and are routinely tested for pathogen and metal contaminants. 2. Testing. Samples requested from contracted manufacturers are sent for lab analysis to third-party laboratories, and the findings are documented based on customer request, and the samples are organoleptically analyzed in-house. Third is inspection and internal audit. Inspection evidence by a third party within the last 12 months must possess an acceptable rating and provide the report of corrective action for review. Serious violations and deficiencies are not approved. Next is the verification schedule. New or changed product samples are verified and evaluated utilizing an independent laboratory, and samples may be tested throughout the year to compare raw and finished product results. Fourth, under procedure is sampling plan. USDA tests the following products, and test results are kept at quality office. 1 is for raw and 2 is for processed. Next to sampling plan is internal audit procedures. The SQF Food Safety Code guidelines are used when performing the internal audit, which you may refer to SQF Food Safety Code Compliance Audit Checklist Questionnaire. And lastly, under procedure is customer specification. Any changes to the customer specification are fully documented and communicated to the contract manufacturers by sending new specifications with the changes highlighted and identified. The quality department verifies that the contract manufacturer is aware of the new changes to the specifications and that the product produced after the change has been implemented reflects those required changes, which you may refer to contract manufacturer quality agreement. The fifth component of the program is responsibility. The responsibility of the person is indicated. It covers what to perform to comply with the procedure or the policy. First is the responsibility of the PCQI or the Preventative Control Qualified Individual. First, visual inspect areas for compliance with this policy. Second, oversee compliance of procedure. Third, ensure personnel is trained on this policy and procedures. And fourth, monitor and take corrective action to ensure compliance with this policy. Next, the supervisors or department heads and team leaders are responsible to ensure and verify this policy and procedure is adhered to, and take corrective action to ensure compliance with this policy. For the quality personnel, their responsibility is to validate training and adherence to policy and procedure, and monitor and document nonconformance observation, also known as discrepancy, using corrective action, preventive action, or the CAPA report. The sixth component of the program is corrective action. The corrective action is the process of taking appropriate steps to eliminate causes of nonconformities or other undesirable situations. If contract manufacturers fail to meet the above criteria, they will be removed from the approved contract manufacturers list. Document all deficiencies and report back to contract manufacturers. And in the event of changes in the contract manufacturer's requirements, inform the concerned department and update all relevant documents and implementation. Next to corrective action is review quality. The review section serves as guidelines for conducting the annual or periodic review. It includes review of the contract agreement and procedures for monitoring and verification of contract product, records of certification, internal audits, product sampling and testing from contracted facilities, and records of SQF audits of facilities contracted to manufacture high-risk food. Then eighth is reference documents. The reference documents are the set of documents used to implement and monitor a program, policy, or procedure. It includes the Contract Manufacturer Registry, Contract Manufacturer Quality Agreement Template, the Contract Manufacturer Audit Schedule, the Contract Manufacturer Audit History Log, and the Contract Manufacturer Qualified Auditor Registry. Then the ninth component of the program is reference. The reference section is composed of guides utilized to implement the program. Examples are the certification guide, regulations, and other widely accepted scientific journals, research, and the like. It must comply with the standard format citation, which can be based on either MLA, APA, or the Chicago style, and update the access date. Lastly, history. The history section is where we can update the program if there are any changes or revisions made in the document. If there is a revision, enter the revision number, followed by the revision date, the description of the change made, the name of the author or the originator, and the title or department of the originator or the author. Thank you for participating in this document review. Content presented are for training purposes only and are based on the interpretation of standards and best practices and must be customized for your intended use. To fully customize your programs, policies, procedures, forms for records, and lessons for training, you may contact Interlink IQ or Consultier Inc. at services@interlinkiq.com or simply call 202-982-3002. For free access, visit interlinkiq.com.